Hi there, I wanted to do a video today on arthritis degeneration and how the spinal flow technique can possibly help you. And so I know for myself, when I was in private practice, so many people came to me and said, I'm in pain, or I'm suffering, or I've got back pain, I've got sciatica, or I've got neck pain, I've got whiplash, I've got headaches. And it's because my doctor said I've got arthritis, or my doctor said there's degeneration. And so if that's you, then definitely listen to this video, or if you know someone else, then I'd love you to share this video with them, because that's what I heard all the time in my practice. And so for me, I was like, okay, hang on a second. Let me find out if someone's coming to see me and they've got headaches or neck pain and they're saying the cause is from arthritis degeneration. I wanted to know more and to understand more. So the first thing that I would ask my clients is, how long have you felt like your neck pain, or like, where did it come from? And they might have said, look, it was just there a week ago, or it's been there 2 weeks ago, but I went and I got an x-ray and the x-ray showed there were degenerative changes, or arthritis changes in the spine. And so for me, when I had a look at the x-ray in the spine, I could see that there was changes in the spine. I could see that there was degeneration or degenerative joint disease, or some type of change in their joints. I could see that. But what I could also see, that hadn't happened just in a week or two. So the pain and the symptom that they were feeling with, it might have been their low back pain or the sciatica or the neck pain or the headache. And what had happened is that they had got that symptom. They'd gone to their doctor or their chiro or their physio. The doctor, chiro, physio took an x-ray and said, okay, there is evidence of arthritis here. That's the cause. And often when I saw them, I was like, but hang on a minute. What I could see in the spine with the x-ray changes, it looked like it had been there for a really long time. I could see on the x-ray that it had whitened, which showed me that it wasn't arthritic change for a week. It had happened over time, which meant that the client's symptom that they were experiencing or coming to see me with wasn't a cause from having arthritis or degeneration in the spine. It was as well. It was, okay, there's degeneration or arthritis in the spine. That's what's happening in there. We can see that on an x-ray. That is true. But that doesn't necessarily mean it's the cause of pain. It might mean that there are changes going on. So I wanted to share that with you, because that's quite important, because you may be experiencing pain or different symptoms, and you may have been told that that's because of arthritis degeneration, but that might not be the case. The case might be that, yes, there's arthritis or degeneration going on in your spine. That's what's happening. But the pain and symptoms didn't come on because of that. The pain and symptoms may have become on because of increased stress in your life. Stressors like physical stressors or chemical stressors or emotional stress, if they're not resolved, they get stored in our body as a spinal blockage. When there's a spinal blockage, what that does is that can store actually at areas where there's already arthritic change, there's already degeneration. It might store in those areas, which can bring about pain or disease or illness in an area for sure. But it doesn't mean they're related. And the reason I know that is because I've taken lots of x-rays of my past clients where I've seen that there's degeneration or arthritis in their spine, but it didn't mean they had pain. It didn't mean they had sciatica or neck pain or headaches. It just meant that, yes, the vertebra was starting to have wear and tear, changes were happening. And what I've seen with a lot of clients is that after a certain age, there is an element of wear and tear in the spine. The vertebrae do come closer together. There can be less disc space. We can get some spurs that start to develop. So we can get those degenerative changes that happen as a result of aging. But that doesn't mean pain. And it doesn't mean disease and illness. It means that the body is changing. What I've also seen is that I've seen people that have symptoms and pain, disease, and different things going on, and sciatica and headaches, and they've had no evidence of arthritis and degeneration. So I'm just trying to show you that they don't necessarily mean they're linked. It might mean that if you've had that and you go and see someone and they show you the x-ray and they say, we can't do anything about it, there's arthritis and degeneration, My question is, did that just come on now, or has that been ongoing? Because there's a reason your body's doing pain. There's a reason your body's doing different types of symptoms. Let's find that out. So if you have got degeneration, if you have got arthritis, I understand, I get it. It could be in your spine, but that may not be the reason why you're in pain. It also might be not the reason why you can't heal. So a lot of people come and see us, my spinal flow practitioner, and say, I can't do anything about it. I've got this going on in your spine. That's not true. What I know for sure is even if you have degeneration and arthritis in your spine, your body can massively change. You can have less blockage in your spine. You can have a beautiful spinal wave in there. Your body can move towards healing, and we get incredible results with people by decreasing the blockages or eliminating the blockages, increasing the wave, decreasing the layers. Even people that have degeneration, arthritis happening in the spine get those changes, and they can become symptom free. So I would love for you, if you do feel like you have got arthritis or degeneration, or you have been diagnosed, go and see one of my spinal flow practitioners, because they'll be able to determine where the blockages are, if there are blockages. As long as there's spinal blockages going on in your spine and that's interfering with the flow of energy up and down the spine, they can help you. They can help you restore those blockages, get more movement, more flow in your spine, and move your body towards healing. So please know, in my experience, even if you have degeneration going on, your body can release blockages and move towards healing. If you don't have it, your body still can do it. So please know that just because our bodies change, our bodies can have degeneration and spurs and decreased disc space, it doesn't mean that that's associated with pain, disease, or illness. So please know that there's still hope. Your body can heal. Go and see someone and move towards greater healing.